What if I told you there's something happening right now in your city, in your neighborhood, maybe in your own home, that's killing people faster than cigarettes, faster than obesity, faster than alcohol? And the worst part? Most people don't even know they have it. In 2023, the US Surgeon General released a report calling loneliness a national epidemic. Not a feeling, an epidemic, like a disease spreading through society. And the numbers are staggering. Over 50% of American adults report feeling measurably lonely. That's 1 in every 2 people you pass on the street. Here's where it gets wild. Researchers at Brigham Young University found that social isolation is as damaging to your health as smoking 15 cigarettes a day. Not 1, not 5, 15 every single day. And unlike cigarettes, there's no warning label on loneliness. Now before you think, okay, I have friends, I'm fine. Stop. Loneliness isn't about how many people are around you. You can be at a party with 200 people and feel completely alone. You can be married for 20 years and feel unseen. Loneliness is about the gap between the connection you want and the connection you actually have. This isn't a new human feeling. Loneliness has existed forever. But what is new is the scale. 50 years ago, the average American had 3 close friends they could call in a crisis. Today, that number has dropped to 1, and 12% of Americans say they have 0 close friends. 0. So what happened? Why did we go from bowling leagues in neighborhood, block parties to everyone sitting alone in their apartments? The answer isn't simple, but there are 3 main culprits. And one of them is something you probably used within the last hour. This video isn't about feeling sad. This is about your biology, your lifespan, your mental health, and a social crisis that governments are now scrambling to fix. The UK appointed a minister of loneliness. Japan created an entire government department for it. And the US Surgeon General called it one of the most urgent health crises of our time. If governments are this alarmed, we should probably pay attention. Here's what we're going to cover. First, what loneliness actually does to your body. The science will genuinely shock you. Second, why modern life is specifically designed to make you lonelier. Third, who is most at risk right now. And fourth, what actually works to fix it. Let's start with your biology. When you feel lonely, your brain doesn't treat it like a bad mood. It treats it like a threat to survival. Think back to early humans. Being separated from your tribe, that literally meant you could be eaten by a predator. So your brain evolved an alarm system for social isolation. And that alarm system, it's still running in your head right now. Here's what that alarm does to your body. It floods your system with cortisol, the stress hormone. A little cortisol is fine. It helps you react to danger. But when you're chronically lonely, you're producing cortisol constantly. And that constant stress response is like leaving a car engine, running 24 hours a day. Eventually things break down. That constant cortisol does something terrifying to your immune system. It makes it work against you. Lonely people have higher levels of inflammatory markers in their blood. Inflammation is linked to heart disease, diabetes, Alzheimer's, and even cancer. You are literally more likely to get sick and stay sick longer if you're chronically lonely. Lonely people also sleep worse. And this isn't just anecdotal. Studies show that lonely individuals have more micro-awakenings. During the night, their brain keeps scanning for threats even while they sleep. So you can sleep 8 hours and wake up feeling exhausted. And poor sleep, as we know, sets off its own chain reaction of health problems. Here's one that blew my mind. The part of your brain that processes physical pain, it's the same part that processes social rejection. So when someone ignores you, leaves you on red, or excludes you from a group, that your brain literally registers that as physical pain. Loneliness hurts, scientifically, not metaphorically. Loneliness also accelerates cognitive decline. Lonely older adults are 64% more likely to develop dementia. Their brains actually shrink faster in social isolation. Here's why. Your brain is a social organ. It literally evolved to process social information. When you deprive it of that, it atrophies, like a muscle you never use. And all of this adds up to one brutal bottom line. Chronically lonely people die younger. The research shows a 26% increased risk of early death. To put that in perspective, that's a bigger risk factor than being overweight. We've spent decades and billions of dollars fighting obesity. Loneliness gets a fraction of that attention. But here's what makes this a genuine crisis, not just a health statistic. Loneliness creates a vicious cycle. The more isolated you are, the more your brain starts to see social threats everywhere. You become more suspicious of people's motives, more sensitive to rejection, and so you pull back even further. Which makes you more isolated, which makes your brain even more defensive. It's a trap. This isn't abstract. In 2018, a 27-year-old man in Chicago, let's call him Daniel, had a good job. A nice apartment, a social media following of 4,000 people. He hadn't had a real conversation, not texting, not commenting, actual talking, in 11 days. He wasn't depressed in the clinical sense. He was just slowly disappearing into himself. He's not unique. Millions of Daniels exist right now. And that brings us to the most uncomfortable irony of our age. We have more tools to connect than at any point in human history. Facebook, Instagram, TikTok, Discord, Snapchat. We are technically more connected than ever. Yet we are lonelier than ever. Why? Because connection and communication are not the same thing. Think of it this way. Social media gives your brain a hit of social stimulation. A like, a comment, a follow. But it's like junk food. It activates the same reward pathways as real connection, but without the nutrition. So you keep consuming more and more, and feeling emptier and emptier. Your brain is full. Your soul is starving. So your body on chronic loneliness, stressed out, inflamed, sleep deprived, cognitively declining and dying earlier. And social media, our supposed solution, is largely making it worse. So how did we get here? Let's talk about how modern society was designed, accidentally or not, to make you lonely. Let's start with where you live. Suburban America was designed around the car. Your house has a garage. You drive to work, drive to the grocery store, drive to the gym. You could go an entire day without making eye contact with a single neighbor. Urban planners call this car-dependent living, and research shows it's one of the biggest structural drivers of loneliness. Sociologist Ray Oldenburg coined the concept of the third place. Your first place is home. Your second is work. Your third place is somewhere you go just to exist with other people. No agenda, no transaction, a bar, a church, a barbershop, a park, a library. These places are disappearing, and with them, the informal, unplanned connections that used to define community life. There's also a cultural problem. In America, especially, being busy is a status symbol. I've been slammed lately as almost a humble brag. We've created a culture where maintaining deep friendships feels like a luxury we can't afford. Friendships require time, unscheduled, unpredictable, and productive time. And that's exactly what modern productivity culture tells you to eliminate. Remote work removed one of the last reliable places where adults made new friends. The office. Before you say office friendships aren't real, research shows that a significant portion of adult friendships form at work. When you remove that, people lose their built-in social structure. And making new friends as an adult without that structure is genuinely, brutally hard. And then there's the algorithm. Every major social platform is designed with one goal: to keep you scrolling. Not to connect you meaningfully, to keep you consuming. The longer you scroll, the more money they make. And the most effective way to keep you scrolling? Outrage, comparison, and FOMO, none of which make you feel more connected. Even dating. One of the most fundamental human drives for connection has been gamified. Dating apps turned finding a partner into swiping a product catalog. Research shows that people on dating apps report higher levels of loneliness, lower self-esteem, and more dissatisfaction with their social lives than people who meet partners in person. And let's not ignore economics. The housing crisis has forced millions of young people into situations that destroy community. Living with random roommates you found online, moving every year because rent went up, couch surfing, or simply staying in a city you don't like because that's where the jobs are. Community requires stability. You can't put down roots if you're always moving. Now, who's actually hit hardest? You might assume elderly people. And yes, elderly isolation is a massive crisis. But here's the shocking finding. The loneliest demographic in America right now is not elderly people. It's Gen Z, people aged 18 to 27, the first generation to grow up with social media from childhood. And the loneliest generation ever recorded. Men are also facing a specific crisis. Research shows that men have fewer close friendships than women, and are far less likely to maintain them over time. A lot of men have what researchers call surface-level friendships. Guys they watch sports with, guys from work, but nobody they could call at 2 a.m. when something is really wrong. The cultural pressure on men to not need people is literally killing them. And the elderly? The crisis there is genuinely heartbreaking. In the UK, 1.4 million elderly people go more than a month without speaking to anyone, not texting. Speaking. Some haven't been touched. A handshake, a hug, in years. The body registers absence of touch as a form of deprivation. And for elderly people in care homes or living alone, that deprivation is constant. Even college campuses, places literally designed to bring young people together, are experiencing loneliness crises. Post-COVID, universities found the student loneliness levels never returned to pre-pandemic baselines. Thousands of students live in the same dorm building, eat in the same cafeteria, and still feel completely invisible. And this isn't just America. Japan has a phenomenon called ikikomori. Yeah, people who shut themselves in their rooms for months or years, completely withdrawn from society. Some estimates suggest over 1 million Japanese people live this way. In South Korea, loneliness-related deaths, people dying and not being discovered for weeks, have become a documented social issue called godoksa. So modern life has built a perfect loneliness machine. Car-dependent cities, dead third places, busyness culture, remote work, addictive social media, economic instability, they're all working together to strip away the conditions where connection used to happen naturally. Now the question is, what actually works to fix it? Before we talk solutions, let's clear out the useless advice. Just put yourself out there. Download a new app, smile more, go to networking events. Research on these generic suggestions shows they don't address the root cause. In fact, forcing an introverted or anxious person into superficial social situations can increase loneliness. The solutions that work are more specific and more surprising. The research on how friendships actually form is fascinating. Psychologist Robin Dunbar found that it takes roughly 200 hours of time together to go from acquaintance to close friend. But here's the key. It's not about quality time. It's about repeated, casual, unplanned contact. Running into someone at the mailbox. Grabbing coffee because you both happen to be free. This is why neighbors and co-workers used to naturally become friends. And why intentional socializing often feels forced. Joint activities create what psychologists call behavioral synchrony. Doing things in physical rhythm with other people. Singing in a choir, playing in a band, team sports, rowing, group exercise, even cooking classes. Research shows these activities release oxytocin, the bonding hormone, far more effectively than conversation alone. You bond through doing together, not just talking. Brené Brown's research on connection found something that sounds counterintuitive. Vulnerability is the birthplace of connection. Sharing something real about yourself, not performing, not impressing, is what allows another person to actually see you. And being seen is what cures loneliness. The irony is that people hide their loneliness out of shame, which is the exact thing that would fix it if they revealed it. We often focus on making new friends when the research says, invest deeper in the relationships you already have. Most people have a network of relationships that have gone dormant. Old friends, old colleagues, family members you haven't really talked to in years. A single genuine reconnection, not a hey, how are you, but a real conversation, can reignite a meaningful bond faster than you think. Some of the most effective solutions aren't individual, they're architectural. Cities and neighborhoods that prioritize walkability, public parks, benches, mixed-use spaces, and public transit create what urban planners call social infrastructure. Copenhagen consistently ranks as one of the least lonely cities in the world, and it's not an accident. It was designed that way. Community organizations, churches, civic groups, sports leagues, volunteer organizations have been declining for 50 years. But the data is clear. People who are part of any organized group, regardless of what it is, report dramatically lower loneliness. It doesn't have to be meaningful. A bowling league, a book club, a Sunday run group. The activity is the excuse. The people are the point. The U.S. Surgeon General's 2023 report actually laid out a specific framework, 6 pillars for rebuilding social connection as a society, strengthening social infrastructure, enacting pro-connection public policies, mobilizing the health sector, reforming digital environments, deepening our knowledge, and cultivating a culture of connection. This is now official public health policy. Here's an important tension. A lot of loneliness advice puts all the responsibility on the individual. Be more vulnerable. Take initiative. Put down your phone. And yes, individual action matters. But we should also recognize that much of this crisis has structural causes. Expecting individuals to overcome car-dependent cities and exploitative social media through sheer willpower is like blaming fish for the dirty water. But you can't wait for governments and corporations to fix it. So here are 5 things the research says actually move the needle. 1. To call someone, not text. Call them. Someone you haven't spoken to in over 3 months. 2. Find one recurring activity that puts you around the same people regularly. 3. When you're in public, try making one moment of eye contact and smiling. 4. Tell one person something true and slightly vulnerable about yourself this week. 5. Protect unscheduled time in your calendar for spontaneous connection. Nicholas Epley at the University of Chicago ran an experiment on commuter trains. He asked some commuters to talk to a stranger. Everyone predicted it would be uncomfortable and awkward. What actually happened? Almost universally, People reported the conversation as the best part of their commute. We systematically underestimate how much other people want to connect with us. One of the fastest ways to reduce loneliness biologically: physical touch, a handshake, a pat on the back, a hug that lasts more than 3 seconds. Research by Dr. Matthew Hertenstein found that humans can communicate at least 8 distinct emotions through touch alone. And that brief touch from a stranger can measurably reduce cortisol. We are a touch-hungry society, and touch is free. A brief note on pets, because the data here is interesting. Pet ownership does reduce loneliness, but primarily by giving people a reason to go outside a routine and social interactions with other pet owners. It's not the pet itself that's the primary cure. It's the social infrastructure that comes with pet ownership. Dog parks are third places. Dog walkers become community connectors. And at the policy level, what's working? The UK's loneliness strategy includes social prescribing, where doctors can literally prescribe community activities. Japan's loneliness ministry funds social reconnection programs. Finland's schools explicitly teach children how to form and maintain friendships. These aren't soft initiatives. They are proven cost-effective public health interventions. Here's the broader truth. Every major crisis of our time, mental health epidemic, political polarization, falling civic participation, rising extremism, is made significantly worse by loneliness. When people feel disconnected and unseen, they are more easily recruited into tribalism. They are more susceptible to misinformation. They are more likely to give up on democracy, on institutions, on each other. We are social animals. This is not a preference or a personality type. It is our fundamental biology. We evolved to need each other, not just for comfort, for survival. Connection is not a luxury on top of a good life. Connection is the good life. Every other thing we chase: money, status, productivity, followers, because at its deepest level, a bid for belonging. I want to ask you something honest. When was the last time someone really knew how you were doing? Not fine, not busy, but actually knew. When was the last time you let someone in? Not because you needed help, but because you chose to be known. If you're watching this and realizing it's been a while, that's okay. That's the point of this video. Here's something the research also shows. Connection is contagious. When you invest in your relationships, it doesn't just help you, it ripples outward. People with strong social bonds influence the people around them to have stronger social bonds. One genuinely connected person in a community raises the social temperature for everyone nearby. You are either radiating warmth or absorbing it, and you have a choice. Before we close, I want to say this clearly. Feeling lonely is not a personal failure. It is not a character flaw. It is not a sign that you are broken or unlovable. Loneliness is a signal. Like hunger or pain, there's something important is missing. And just like hunger doesn't mean you're weak, loneliness means your social needs are legitimate, real, and worth addressing. Swiss Surgeon General Dr. Vivek Murthy wrote, in recent years, about 1 in 2 adults in America reported measurable levels of loneliness. And this was before the pandemic. He added that in his years as a doctor, the most common pathology he encountered wasn't heart disease or diabetes. It was loneliness. A Surgeon General talking about loneliness the way they once talked about smoking. That's how serious this is. So here's your challenge. In the next 24 hours, reach out to one person you've been meaning to connect with. Don't text, call, or better yet, suggest meeting in person. Tell them something true. Listen without waiting for your turn to speak. And notice how you feel afterward. Because the antidote to loneliness is not a pill, not an app, not a subscription service. It's another human being. It always has been. If this video made you think about someone, call them. If it made you realize something about yourself, sit with that. And if it helped you understand why so many people around you are struggling, share it. Because one of the loneliest things about loneliness is feeling like you're the only one. You're not. We're all in this together, if we choose to be.